Everyone, welcome to my channel. Ravi is Physio. So in the series of biophysics, we studied and moved further in electromagnetic spectrum. So why we are studying? Because the like UVR and IR based on this method. So we are studying the electromagnetic spectrum. So what is the electromagnetic spectrum? The entire range of electromagnetic radiation, which includes all form of life from radio waves with longest wavelength and lowest frequency to gamma rays with shortest wavelength and highest frequency. So the radio wave has longest wavelength. It means they will be induced to the deeper tissue and the frequency is to be low, but the gamma rays has to be shorter wavelength. But it means the wavelength is to be shorter, but the frequency, this frequency is like rapidly into the body is to be high. So in an electromagnetic spectrum, so first is radio waves. It has largest wavelength and lowest frequency used for communication, like radio FM. Next is to be microwaves. So shorter in wavelength, higher frequency. It compared to radio waves used in navigation and weather forecast. This types of frequency or microwave is to be used on the heating on the food materials, but the only food or watery content is to be heated, but not is to be plastic content is to be heated. Or also used to be the navigation of the aeroplane and flight jets, or and also the weather forecasting. The microwave is to be used. Next is to be infrared. So we are using the infrared for therapeutic purpose, for tissue healing and pain relief, and also the detoxification, also the arrhythmia. It is the form heat as they are emitted from object used in physiotherapy in the form of heat therapy. So we are studying. Next is visible light. So infrared I can't show that their light, but in physiotherapy we are shown that both, like visible and non-visible infrared waves, which is visible to human eye and made of 7 colors with gear, in which violet has lowest wavelength and red has highest wavelength. So violet has lowest wavelength, but the frequency is to be high, and red has highest wavelength but frequency is to be low. Ultraviolet rays, this is also studied in physiotherapy for therapeutic purpose into the wound healing and detoxification of the bodies or tissue or like wound. These are high frequency waves. If the exposure time too much, then it can lead to skin condition like cancer or burn. It means they can emit from different like object, and if there is too much exposure to our body, so they will cause the cancerous effect or burn is to be occur on our body. But it's to be also used in physiotherapy for relief of pain. So next is to be, it is used in physiotherapy for treatment or skill condition using optional doses depending on the patient sensitivity. On the patient sensitivity, we are using the ultraviolet ray. Next is to be X-rays, used in the medical investigation, can visualize inside the body for the X-ray report or for visualizing the bone and their approximation. It will be like bony deformities, bony fractures for reading of the X-rays. Next is to be gamma rays, having highest frequency and smallest wavelengths, is emitted from radioactive materials. For that kind of purpose we are using the gamma rays. So the ultraviolet rays we are studying in physiotherapy. So physiological effects of ultraviolet: aging, it will be reduce wrinkles over the body, production of vitamin D if there is lack of vitamin D in our body, so ultraviolet is good option. Antibiotic effect, it mean with any kind of wound, so there is chance for like virus and fungus is to be occur over there and like cause very much infection over there, so we can apply ultraviolet over there. Antibiotic effects are also that. Erythema, redness is also over there. It will be applying UVR for 10 to 15 minutes, so erythema or vasodilation it will occur. So nutrition will be like provided to whole body. Indication: wounds and acne vulgaris, rickets and psoriasis. So that kind of disorder we are applying the UVR. Also acne vulgaris is also using. Psoriasis, a joint wound will be occur for long time of sleeping or like sitting. So in the coma patient we are like developed psoriasis because there is oxygen supply is not good, so there is chances to occur psoriasis. Rickets, deficiency of the vitamin D, there is bone is like to be C-shaped or curve shaped, so we are applying the ultraviolet for the supplying of the vitamin D into the bone. Contraindication for those who have like acute skin condition or acute injury. Hypersensitivity to sunlight is to be allergy up to the sunlight. Skin grafting, if there is a person who have to be like grafting their skin and they will be shifted to another part, so there is a chances to burn over there, so we cannot apply. Pyropyria, it means there is like symptoms over the body that will not apply danger. Shock action will be occur if you are like rapidly used or like long time exposure. Eyes means to be conjunctivitis, it will be red and inflammation over the eyes, it will be long exposure to that. Make sure you can before the applying UVR you can use the googles into the eye for protection. Iritis, inflammation in the iris. Cataract will be occur also in eye, and overdose UVR can cause to burn. Thank you.